Healthcare means that you can afford to go to a doctor. Healthcare means that you're not bankrupt if you have a catastrophic illness. And unfortunately, what passed didn't make any sense. As we know, when Obama promised you wouldn't lose your doctor, what happened with that? Biggest lie of the year. Deductibles have skyrocketed, premiums have skyrocketed, co-payments have skyrocketed, and basically what was a catastrophic plan back then is the normal plan now. So it doesn't make any sense. Now we've got these Biden COVID-era subsidies. It's unbelievable fraud. The money's going directly to insurance companies. How does that make any sense? We're subsidizing health care of millionaires. That's wrong. And that's exactly what these Biden COVID-era subsidies did. I want to thank the chairman for putting this together. Back in 1929, I organized a group called Conservatives for Patients' Rights to try to figure out how, if we're going to pass health care reform, let's do it in a manner that drives down the cost of health care. Because I think all of us want to make sure people not just get health care insurance, but they actually get health care. Health care means that you can afford to go to a doctor. Health care means that you're not bankrupt if you have a catastrophic illness. And unfortunately, what passed didn't make any sense. As we know, when Obama promised you wouldn't lose your doctor, what happened with that? Biggest lie of the year. He promised you wouldn't lose your plan. No, you lost your plan. Then they set it up to where there was an increased incentive to take care of able-bodied adults rather than, in my state of Florida, the state got paid more money to take care of able-bodied adults than people on disability. I mean, that actually made no sense at all. Then what's happened is exactly what we thought. When I became governor, so I was running different companies at the time. I bet the deductible was, I can't imagine it was more than $1,500. A catastrophic plan was $3,000, or it couldn't even be $5,000. And now what you look at is deductibles have skyrocketed, premiums have skyrocketed, co-payments have skyrocketed, and basically what was a catastrophic plan back then is the normal plan now. So it doesn't make any sense. And then to mask the cost of these premium increases, which the premiums are going up. Why are the premiums going up? Well, hospitals are charging more money. Drugs are charging more money. All the players in it are charging more money, and then there's nobody there that says, "Oh, do I really need to spend that money?" Like all of us have children, know that our children spend the money they make way more efficiently than this money that we give them. And so it just seems to me, if we actually want to fix this, there's really only two things that really are going to fix it. One, we've got to make every American a consumer of healthcare. That means when you go buy something, you look at the price, you look at the quality, you look at the service, you question it. That's what we should be doing in healthcare. But people don't have actually the opportunity to do it because they're dictated by either the government or they're dictated by their employer of what they have to buy. They don't have choices. They don't have a choice of a whole bunch of different plans they get to do. Then on top of that, let us, we need to make sure anybody that needs health care, they've got to have access to a plan that they can afford. And before Obamacare, I think it was 40-some states had high-risk pools that really took care of the people that had chronic problems that were significantly higher than what a normal person would have. Unfortunately, Obamacare stopped all that. So the only way we're going to get this fixed is, number one, we've got to make everybody a consumer. So if we're going to get, my belief is I did it when I was a consumer. I let my employees choose their health care, choose their plan. I didn't say, oh, you have to buy this plan. They had co-payments, they had deductibles, so they had incentives. to be healthy. So we need to be able to do that with regard to any government-sponsored program. And then there has to be unbelievable choice. So one person might be worried because of family history of something. Another person is not worried about that, so they don't want to do it. So we got to figure this out. So now we've got these Biden COVID-era subsidies. It's unbelievable fraud. The money's going directly to insurance companies. How does that make any sense? It goes just check directly to the insurance companies. We know millions of people have been getting supposedly been covered. They don't even know it. They don't even know it. I mean, the money just went to an insurance company, right? Nobody knew it. And so I'm glad the ranking member wants to crack down this fraud. Why didn't they do it when they passed this? I mean, there was unbelievable fraud allowed. I think all you had to know is somebody's name, address, and birth date, and you could sign them up. And people were doing it all the time. And then we have people that are worth $1 million, and we're subsidizing their health care. Now, most Americans are not worth $1 million. So we have people that are busting their butt, working every day, 40, 50 hours a week, and we're subsidizing health care of millionaires. That's wrong. And that's exactly what these Biden COVID-era subsidies did. So I want to make sure people get health care. I want to make sure that if you have a chronic illness, you have a plan to get it. But this idea that no accountability, insurance companies make all the money, and no accountability, and for rich people, it makes no sense to me. So, Mr. White, my staff looked at some of the plans available in Madison, Wisconsin on the individual exchange. The premiums are too high, right? And deductibles are too high. And so often, I mean, you can get insurance, but you don't get health care, right? So how's that as compared, what you would get through these COVID-era plans, or the Obamacare plans covered, the mass cost by the COVID-era plans, how's that as compared to employer small group plans? What's happened to the cost?
Yeah, the tragedy, I think you put your finger on it, is that for consumers, you can only use your subsidy on Obamacare. And those plans, in general, have 3 times higher deductibles than the average Obamacare plan. So the average Obamacare plan, the silver level unsubsidized deductible, is $5,000 a year, thereabouts. The average small group plan is about $2,000.
And you can't do it.
You cannot use your subsidy.
Why would they do that?
That's how the law is written.
But why would they do it? Why would that make any sense? Why wouldn't you have an option?
Why wouldn't you have an option?
Yeah.
I don't know. The authors of the law designed it this way, and what we saw pre-Obamacare, about 50% of small businesses offered coverage. Post-Obamacare today, just 31% do. So 12 million people have gone from small business coverage, and they're now getting Obamacare, which means
small business with options.
They're just the small businesses dropped coverage, and they sent their employees onto the exchange, where they're paying 3 times higher deductibles, higher premiums, including unsubsidized premiums, and they're getting worse access to care. 80% of the plans on Obamacare right now are exclusive HMO type plans or exclusive provider arrangement plans, which means if I tried to go out of network to a doctor, the insurer would pay $0. That is significantly impeding my access to care. We have to keep in mind, coverage does not equal care. Just because I have an insurance card doesn't mean I can see a doctor. And what we're seeing in Obamacare right now, compared to the employer market, is I can't see my doctor. I can't afford the deductible, and the doctor's not in my network. If I just stayed with my small business, if we created incentives for small business to retain employees, we would have far lower deductibles, far lower premiums, far greater access to doctors, and taxpayers would spend 3 times less.